Thank you, Michelle, for the introduction and for inviting me to be part of the Lupus series. And like you said, I am in Los Angeles. It's 1 a.m. over here, but I'm excited to be here. Very passionate about what we do, and to be able to talk to all of you about the importance of building a trusting relationship with a physician. As having an autoimmune condition myself and being able to help my sister, manage her lupus, this is one of the things that I think has played a huge role in having her continue to live and thrive despite living with lupus. So a little bit about myself. So like I said, I do not have lupus, but I do have an autoimmune condition. I have rheumatoid arthritis, and I also live with fibromyalgia. I am co-founder and president of Looms for Lupus, and we started advocating alongside with my sister when she almost lost her life to lupus. And it's been a passion of ours to not only empower others, but educate and share our journeys. Both my sister and I do it together. We advocate, we empower, we support, and we facilitate support groups as well. And a little bit about me and my background. I have worked in healthcare for 30 years. And yes, I may not look it, but I'm already 50 years old. So I've been working in the healthcare industry for a while, work with providers, physicians, different specialties. And my sister is a social worker by trade. And growing up, we knew nothing better than to be in other people's business and help them out in any way that we can, because that is how our parents raised us. So I'm excited to be here today. Both my sister and I are huge healthcare advocates. We not only provide all the support and empowering and education in English, but we also do it in Spanish, and we support caregivers and loved ones as well. So it is something that for us, it is personal. My sister almost lost her life to lupus, and it impacted not only her kids, her husband, but it impacted the siblings as well. It impacted me, and it impacted my mother, our family, and the community as a whole. So for us, to be able to help one person is already a big deal for us. So, like I said, my sister was diagnosed with lupus back in 2009, and she almost lost her life to lupus or complications of lupus. And the reason she is alive today is because she advocated for herself. If she would not have advocated for herself, she would have died. And so it is very important to be able to communicate to the providers and build that relationship with them so they can understand what you're going through and help you navigate your care. So today we're going to be talking about the importance of building that trusting relationship. We're going to talk about the different components, what does it mean to create or to have that great relationship? We need trust, we need communication, we need to have that respect and that mutual partnership. We need to be able to support each other. The provider needs to be able to support us. We need to be able to support them with information. And also, I'm going to be talking a little bit about advocacy and why advocating for yourself is so important. And it doesn't have to be with legislators or with policymakers, but it could also be advocating for yourself with your provider or your physician or your care team. I'm also going to talk about not only the importance of building a trusting relationship with your provider, but also with office staff. So why is it important to build a trusting relationship with your physician? Well, when managing your care, especially when you're living with an autoimmune condition like lupus, building this trusting relationship with your physician is crucial, because not only is it going to help you feel comfortable talking to them about your care, talking to them about your symptoms, talking about, how to manage your condition effectively, but it's also going to lead to being, having less flares and hopefully being in remission and ultimately having better healthcare outcomes. So what is it that encompasses this great relationship that I'm talking about? It is trust, right? It is communication. And really, trust is the foundation. And what really makes this relationship a meaningful relationship, right? It is fostering a sense of that safety, that respect, that mutual understanding. It allows both the provider and you, the patient, and even your caregiver to have this honest and open communication. And this also allows us to not only hear them, listen to them, respect their opinions and recommendations, and also for them to respect our feelings and to also hear us. This partnership, collaborative approach that we're going to have with our physicians allows us to be able to work together to manage not just the symptoms, but also our overall care. And by this, I mean your mental health and your physical health, because we know that living with lupus can affect both physically and mentally. And of course, knowing that there is the support, that other individual that's in the room, that's sharing, that's giving you the advice, that's helping you manage your conditions, is there to support you and ultimately be the best advocate for you. So we need that unconditional support from our providers as well. So talking about all these components, think about it, and I could probably revisit this at the end of the session is, do you have all these components when you talk about having that relationship with your provider? Do you trust your provider? Do you trust your care team? Are you able to communicate effectively with them? Do you trust them? Do you trust their advice, their recommendations? Do you have that partnership, or does it feel like it's only one-sided, right? Think about it, and maybe we can revisit it and talk about it a little bit later. So when you're talking about trust and communication, those two are what I say the foundational two things that you need to have this effective healthcare, if you will, right? When you trust your care team, you then are more likely to follow and to know that their advice and their expert advice is really what's going to be working for you, right? And you trust their decisions. And communicating is also very, very important. And being able to trust that provider, trust that when you share about your symptoms, when you share about your concerns, maybe preferences around, what you can modify or do for yourself, based on your cultural preferences, being able and comfortable to share that with them is very important. And all this good communication and trusting your provider or providers, because we know with lupus, you're not just seeing one rheumatologist, you're going to be seeing multiple specialists, because if lupus loves other organs, then it starts manifesting, and then you start getting all these other referrals, right? But ultimately, really, together, all of these elements, the trust and the communication, is what creates this strong partnership. And if you trust your provider and you're able to communicate and understand each other, really is going to be what's going to help you overall with your overall health. And mutual respect, right? Mutual respect is really what fosters a collaborative atmosphere. And these partnerships that we create with these providers is what fosters the better shared decision making, because at the end of the day, we have to do this together, right? The partnership and the respect together is what ensures a holistic, empowering healthcare experience, because this is what it is. We need to be able to enjoy the experience in this journey, because there is no cure for lupus right now, right? We wish there was, but there isn't. So being able to manage your symptoms and manage your daily pains and aches, all of this, you need to be able to communicate and have these decisions made with someone that you trust. So when we're talking about respect and partnership, I know I kind of just gave you brief overview about how these two help together. And these are a couple of examples of what I mean. If you have that trust and you respect your physician and you have this partnership with them, then this is going to help you, know and understand that that respect that you have. So just like when you go visit someone, right? You call them or you make a date or you let them know, hey, I'm going to be there at 7 a.m. or at 7 p.m., whatever it is. You also need to respect the fact that your provider has set a time for you. And the provider as well has to respect the time that they have with you in the room. And this means you preparing for your visits, right? Jotting down any questions that you may have, jotting down any concerns that you may have. And, when you're talking about your the different concerns that you have, also acknowledging that the provider has X amount of time to address the issues or concerns that you have. So preparing for your visits, allocating your first top 3 concerns is more realistic, and it'll be respectful of their time, but also they can respect the fact that you come in prepared to discuss these concerns with them, and it'll help better understand how they can help you. Symptom journal. This is one of the things that I love, because the provider is not going to know how you are feeling. They're not going to know what is triggering the pains, what is triggering your flare. And they don't know because they're not the ones that are with you every day. So it is important for you as a lupus patient or anyone that's living with a chronic condition to jot down your symptoms. Make sure that when you're jotting them down, you indicate what is it making this symptom worse? What is making it better? How long have you had this symptom? What do you think is triggering it? And even if it's like extra little details that you add on, like what is the weather like? Because we know that the environment does affect and impact the symptoms that you have when it comes to lupus. Maybe, if it's a gloomier day, that is impacting your pains, right? Jot that down. Maybe you have had more pain this week than last week. Well, is it because you didn't sleep that well? Is something stressing you out? I mean, all of these things that you may think are not going to play a role or kind of let the provider know what you are talking about, all these things may be significant, and it'll help the provider assess the situation and help you out a little bit better. And plus, as there are no 2 patients alike, right? We're like snowflakes, right? People that have lupus, there's not 2 alike. So it is important for you to jot down as much information as you can. And then also with any relationship, right? If let's say like with my husband, if he expects me to have dinner or I expect him to have dinner ready for me, and we are talking about we're having 7 guests, then we expect the food to feed the 7 people, right? These are expectations. So when your provider expects you to take your medication, to take it, 3 times a day or 2 times a day at for a specific amount of time, or you have to make sure that, you take it at a specific time of the day, you want to make sure that you do take these treatments the way that the provider has required you to do so, right? The adherence to treatment is very crucial. And I know, sometimes some people may be taking a lot of medications, and sometimes you may forget because guess what? Brain fog is real, right? Brain fog is one of the biggest, I think, things that people don't understand, that you can forget, the simple tasks like taking your medication. So trying to figure out ways to set reminders, maybe have your caregiver help you, but adherence to treatment is very, very important. And again, I put this under the respect and partnership because again, if the provider is expecting you to take your medication, please try to do that, because if not, then, it's not going to be a good partnership, right? If we have to lie to each other and say, yes, I've been taking my medication, and that's not really what's happening. Following recommendations, can be difficult, but can also be overwhelming, but it can also be very, very productive if you're able to do and follow what the provider's recommending. And I'll tell you one thing for me, I know it is recommended that I sleep, right, a certain amount of hours a day, and sometimes it's not doable, right? because you may have, pain insomnia. You may not be able to rest because of your pain. You might not be able to sleep because you have to take your medication, and your medication is preventing you from taking that time to rest. I know we can't always follow the recommendations, but we have to try, right? We have to do the best that we can. And if we are not able to, just like with any relationship, when you are not able to meet or do what the other person expects you to do or expects of you, just be honest and let them know this wasn't doable or this was doable and this is why I can't do this, right? Keeping appointments, that's another thing that, I hear about. I know it's tedious. I know we have to see so many specialists. I know, we have to take time off away from our families, our children. And sometimes we feel like all we do is go from one appointment to another. But it is important to keep your appointments, especially when it comes to lupus. There are, I believe the stats on kidney involvement with lupus is, if I'm not mistaken, 1 out of 3 patients with lupus can have or develop kidney lupus nephritis or organ issues with a kidney, right? When lupus is active. And keeping these appointments, keeping the routine testing, like the urine test and lab test, very, very important, because it could prevent you from having irreversible damage. So just important to keep those appointments, whether they're provider appointments or lab appointments, very important to do that. Support. And I know when we're talking about support, just like again with any relationship, it is important for us to feel supported, right? To know that the provider or the care team that is taking care of us is understanding of us, that they support our feelings, that they support and validate, what we are going through, that we feel safe enough to let them know when maybe we are not feeling as well as they think we are feeling, because they look at the numbers and the numbers may be looking fabulous. And I can tell you a story about that. My sister always tells me this, she goes into the doctor and, they're like, oh, well, how are you doing? I see your labs are all looking, normal, you don't have, your inflammation numbers are a little bit lower, you're doing good here, you're doing good there. And she's looking at the provider like, what do you mean? I don't feel good at all. So being able to communicate and let the provider know and and feel safe enough to say, even though my numbers look good, I'm not feeling as good. And having the provider listen to you and, kind of go down to figure out, well, why is it that you're not feeling good? If the labs are good, tell me how I can help you, or tell me what you are feeling. So it is important for us to feel safe, right? And to be able to feel acknowledged, and again, feel seen, and most importantly, be heard, right? Because so many times patients feel like their doctor or their provider does not listen to them, that they are not paying attention to what they're saying. And, sometimes it could be the opposite. It could be, that you get a call from your provider and they tell you, oh, your labs are abnormal, you need to come immediately, there's something that's concerning. And you're thinking, well, what's concerning? I'm feeling the best that I've ever felt, like in this past, 6 months or whatever it is. I'm feeling good. Are you sure there's something wrong? Because I feel great. And it's those times where maybe the labs and the way you're feeling is not meshing up, that, allowing your provider and them allowing you to now tailor your care based on your symptoms versus tailoring your care based on your test results, I think is very important. And, finally, the emotional support, right? Knowing that your provider is there for you, that they are supporting you, that they are listening to you, and that they are going to advocate for you if needed. That to me is very important, and that can make a huge difference in how you are managing your flares or your lupus overall. Advocacy. So at the beginning, I was telling you how when my sister was first diagnosed with lupus, she almost died. And one of the reasons why she almost died and she is alive today is because she advocated for herself. So many times you don't feel that a provider is listening to you, or what they call gaslighting. Maybe your symptoms, they're all in your head. You may not look sick because you have symptoms that are invisible, because not always are our symptoms visible. And my sister was going through something similar, and she was dismissed and she was sent home. And unfortunately, you know, was sent home 3 times. She kept advocating. She kept insisting and persisting. There is something wrong with me. I'm having these ulcers in my nose and my mouth. They look like open wounds. Can you please look at me? The doctors diagnosed her with anxiety. They said, no, go home. You are fine. We'll take routine labs and come tomorrow morning. I was on the other end of the phone with my sister, and she was devastated. And I told her, one thing you have to do is, you as a patient, you have rights. They have to see you. They have to listen to you. Do not leave. Continue to ask to be seen. Continue to get lab results and to have them be reviewed today. And because of that, she is alive today. They were able to see her lab results, and they noticed that her platelet count was down to 8,000. And she was critically ill. By then, hours passed. They did another test. Her platelets were now at 6, then at 2. She almost died. It wasn't until the last provider listened to her and he said, you know what? I think you may have lupus. So we cannot do blood transfusions. Nothing's going to save you. And that provider gave her the opportunity to explain things to him. He listened. He looked at all of her symptoms. And because of that, she was admitted into ICU for 7 days, and she is alive today. And we share her story because we know that if you feel comfortable enough with your provider and you advocate for yourself, then that is what's going to be life-changing at times. And again, that was an example of an emergency room. A lot of lupus patients don't get diagnosed in an emergency room. And obviously, the relationships that I'm talking about today are going to be relationships that you build with your provider after you get diagnosed with lupus. But I wanted to bring that in because I know it is very important. But also, even when you already have your rheumatologist that you often see, it is important to also advocate for yourself and let them know what you're feeling. Let them know if there's a treatment that maybe they're recommending, or maybe a physical activity that they're recommending, or a specific diet that they're recommending. If you're not able or feel comfortable doing it, advocate for yourself. Let them know. And that is going to be a life changer. Being proactive, talking about health goals with a provider, very, very important. It is important for you to be able to let them know what your goals are when it comes to, setting your short goals. Are your short goals about managing your symptoms now? What are your long-term goals? Having these discussions is kind of like having a plan, right? Having an action plan together. And I think that is also very, very important. Asking questions, feeling heard is very important, but also having these questions that you have written down and prepared for when you go see your doctor, making sure that they actually answer those questions, right? It is very important. So advocate for yourself. And if there's a question that you either didn't understand exactly if the provider is answering your question, or maybe they dismissed a question, be proactive. Ask the question again, or let them know if they don't have an answer at this time, can you revisit it? I mean, it's very, very important for us to talk about those things. Also, sharing our concerns, right, and our objectives. If we're having or dealing with a lot of pain, let's talk about managing our pain. What can we do? Is there like acupuncture that can help us? Maybe getting a referral, maybe having, other methods, right? of treatment options, maybe some lifestyle changes. Maybe, what you're eating is not really working for you. Maybe the exercise is not working for you. I mean, talk about and share those concerns and your objectives with your provider. What is it that you want out of these visits, right? So it's very important for you to use your voice and advocate for yourself. Nobody else is going to do it for you. Be that CEO of your body, right? You know what's best for you. And just like any CEO, you are going to hire and fire those people that are going to either help you or not help you. And sometimes, changing providers, if you're not finding the right fit with a provider that you have, it's okay to ask for a second opinions or even see another rheumatologist. And even though my rheumatologist could be the best rheumatologist for me, it may not be the same fit for you. So be open to kind of dating different rheumatologists and seeing what's the best fit for you. And when we're talking about these relationships, one of the things that I was sharing with you earlier is that it is important to not only have a good relationship or a trusting relationship with your provider, but also having it with their staff, right? Because at the end of the day, most of the things that you need, like setting up appointments, getting those referrals, authorizations, all of those are done by the medical assistant or the office staff member that is there to greet you when you get to see your provider, right? So connecting with the staff is very important and building that relationship. They're the first people that you're dealing with. They're the people that answer the phone calls. They're the ones that are going to be filling your prescriptions. They're the ones that are going to give the message to the provider for you and help be that navigator or for you, letting specialists send over your consult notes when you went to see them, so that way your rheumatologist has everything in hand, or sending over lab results that the rheumatologist had for you and sending them to your specialist that you're going to be seeing. They are the ones that are going to be communicating and having that communication flow smoothly between office visits, between the provider, between the pharmacy. They're the ones that are going to be bridging that gap for you. So it is important to also have and foster this great relationship with the staff. And this doesn't mean that you have to bring them, all kinds of goodies, because I know for me, for once, one of the providers that I go to, I'm not allowed to bring chocolates or any yummy things to the staff because the doctor's really, really strict. And she's like, we have to be healthy. So if I go, I make sure I take a basket of fruit, because that is, I'm a giver. I like to give things. I love to show affection that way. So to me, to give them fruit or to give them something that they like is very rewarding to me. And in turn, they might also appreciate it. So, next time you go see your provider, make sure that you say hi to those staff members and thank them because they do a lot of work for us, and they work so hard to make sure that we get the best care that we can have. And who knows, they could be your best advocate as well. And I know we have a few men in the session today, and maybe we all know that lupus affects men, women, children, boys and girls, and but I wanted to share this amazing toolkit. Even though it was created for women, because it was created by the Society of Women's Health Research. So it is a Living Well with Lupus, a toolkit for women. However, it can be used by anyone that has lupus or caregivers that support those living with lupus. Both my sister, who is a lupus patient, and Ayana, another patient advocate, along with amazing rheumatologists and lupus experts, got together and created this lupus toolkit. with the Society of Women's Health Research. And not only does it have a lot of information about like what lupus is, the different types of lupus, and then it gives you kind of like a definitions of different terms. And it's just a toolkit full with amazing information. And at the end of the toolkit, you will find a kind of like a journal page on how to journal your symptoms, how to take notes, how to communicate with your provider. There's amazing little nuggets that you can get out of here. And that is the link that I have. I don't know if you will have the presentation shared with you, but the Lupus Toolkit lives in that link, but you can also obtain it by going to the Society of Women's Health Research website, or if you visit Looms for Lupus website, we also have a link in the resources. And it is a free virtual document that you can download and print out or just view and read. It is an amazing toolkit. So I wanted to share that with all of you because this is the first lupus toolkit that of its kind. We've never seen anything like this. So it's just a good collaboration and amazing information. So I know that I've talked a lot, and I was sharing with everyone earlier, when we first got started is, take away the mic because I can tend to, have over conversations or talk about so many other things. As you can see, I'm very passionate about these relationships and fostering these relationships with the providers because I work with providers. I've been doing this for 30 years. And when I first started, I was a medical assistant. So I was the one that was engaging with the patients, and I was the one that would write down their symptoms and chief complaint, take their vitals, and then go to the doctor and let the doctor know what the patient was here for. I work with physicians right now in documenting and making sure all of the information is documented in electronic health records. So, I know how it is to be able to navigate, being in a room with a provider, and how stressful sometimes it could be to feel like there's a third person there because there's a computer or a laptop. But knowing and understanding that as long as you have that communication, open communication with your provider and letting them know, today, can you please pay more attention to me than documenting, maybe document a little bit later because I need you to hear me out, or maybe you're not feeling, like they're paying attention to you that day. It is good to be able to have these open discussions and express your feelings with the providers. But also, another thing I wanted to share is, at the end of the day, regardless of all of these relationship tips that I have given you that, obviously have worked for my sister and have worked, just in me just talking and helping patients navigate their care. The one thing that I want you to know is you are the most important person when you go into that room, when you are being seen by your provider. Everything really should be around your needs. If you need to see a specialist and get that referral, if you need extra attention on maybe your mental health, if you need extra attention in your specific, chief complaint or complaint that you have for that day, it's all about you. It is okay for it to be all about you. I want to share our social media handles and everything here. And thank you guys for the opportunity. And thank everyone for having me here today and listening to me.